Hi, I'm Dr. Christine Anderson. I am a chiropractor who specializes in pediatrics and pregnancy, and I also have a specialty in childhood developmental disorders, working with the nervous system and functional neurology. So I have a lot of tools in my tool belt to help kids grow up healthy. So I'm finishing up this series on reflexes and the postural reflexes, talking about equilibrium. And this is where we get our balance and our coordination. And in this, I'm going to talk about how if our equilibrium reflexes are underdeveloped, then our children might have things like developmental delays, poor balance and coordination, school problems, social problems, all because these reflexes have not fully developed. So let's dive right in. And just a reminder of this series, I started with the neurologic reflexes. I went on to the primitive reflexes. I talked about the postural reflexes, and last time I talked about the writing reflexes. So I will put the links to all of these in the description, and I also have some playlists that I will put in. I'll have a playlist of everything, and then I have a separate one for primitive reflexes, and I'll do another one for postural reflexes so that it's just right there for you. Just a reminder about what the posture control is what's happening in that. So there is sensory input. There you see an eye for visual input, an ear with the vestibular system in there for vestibular input, and then a leg there to represent proprioceptive input, which is input from the rest of the body, goes into the brain. Now, most of the postural reflexes are at the midbrain level, but the equilibrium reflexes actually have the aspect of cortical input, so it's a higher function in the brain developmentally. And then the brain sends out a command to the body, says, you need to do this movement to balance out whatever else is happening in the environment. And then those movements will send signals back up to the brain and said, well, here's what we're doing now, so that the brain always knows what the body is doing so that it can help tell it what to do to respond depending on what's going on in the environment. Because if you do not do this, then you're going to fall down. So let's go a little bit into that so you can see how that works. This is just another diagram, another way of looking at the equilibrium system, showing you that the feet, the joints, all have proprioception sending information through the nervous system to the brain. So all those wires going from the legs and the arms up to the brain, those are the nerves that filter into the spinal cord and sending the information up to the brain. And then at the top, you've got the eyes for the vision, the inner ear for the vestibular system, and there are actually proprioceptive receptors in all parts of our body, including our spine, because our brain needs to know what our body is doing at all times. A little refresh on the labyrinthine system if you haven't seen this before. I did talk about this in the tonic labyrinthine reflex. It's all going to be below. Just showing you how this all fits in. At the top, you see the outer ear and then the inner ear. And then you can see that snail-shaped structure there. That's the cochlear aspect. That has to do with our hearing. And then it is attached to the vestibular system, which you can see better in the bottom picture. Those three loops of blue, they're labeled the canals. That is the vestibular system, and it's in all planes. So there's an XYZ plane because we are moving our body in all planes, at least I hope we are. And both of these, the cochlea and the vestibular system, are innervated by the vestibular cochlear nerve, which is a cranial nerve. And I talk about this when I talk about primitive reflexes, because this is a lower brainstem function. And this all has to do, if there is anything going on with our vestibular system, we're not going to have good balance. So this is primarily We're talking about the development of children, but even as adults, these things are going to persist. And if we're not using it, we can lose it. And this is why older adults become having a problem with falling because their proprioception isn't working properly, their vestibular system isn't working properly, possibly their visual system. So this is actually something that we need to keep working on even as adults all throughout our life. All right. So as I said, the equilibrium reflexes occur in the cortex, the brain, what we think of as the brain. And these start developing at about 6 months of life, depending which one we're talking about, and they continue on throughout the life. And also, as I alluded to, is that we can keep training our equilibrium volitionally, meaning that we put intention into it. So the reflexes are there to protect us, but we can actually hone them to become even better and better because we will train our brain. So these are going to correspond to the milestones. You can see I've got different times for different positions. So what we call prone or tummy time will be starting at about 6 months. Laying on the back, these reflexes will kick in at about 7 to 8 months. Sitting up, about 7 to 8 months. Getting on hands and knees, 9 to 12 months. And then standing is the latest at 12 to 21. So you can see there's no reason for our postural reflexes for standing to kick in at 6 months because that is not where the brain development is yet of a child. So this really corresponds to everything that goes on with their brain development. So what are these reflexes? Why do we have them? Well, they are protective. They're going to help prevent injury. So you're going to put your hands out to catch your fall automatically. You don't have to think about it. When someone comes up and pushes you, these reflexes are going to kick in so you just don't fall over. It's going to help maintain your body stability. So when there are moving surfaces, it could be if you're just on a boat or a train or something like that, but if you're doing a sport such as surfing and skateboarding, for me it's aerial arts, you are wanting to have that ability. If something is going one way, you need to balance the other, and you don't want to consciously always have to think about every single little movement. So it almost becomes automatic, and you can fine-tune these movements, especially with the cerebellum, which I will talk about at some stage because the cerebellum is super important. Well, the whole brain is important. And then we might have a stable surface, but think about this. When you are walking on something skinny like a balance beam, now you're not going to even think twice about it if you're on the ground. You're like, yeah, I can walk that straight line, right? But once you get a little further from the ground, it's just like, okay, I've got to keep my balance on this thing that might be, it's stable, but it might be thinner than you're used to doing, or like a gymnast who has a stable surface, but they have to balance out all their movements. This is a diagram that shows you how we do that. So we might move our base. In other words, we're going to step or hop to keep our body upright. And this is the case if you think you're falling over, you're not going to just topple over. You'll take your leg on the side you're falling to and you're going to move it over, or you're going to hop. Say you're trying to balance on one foot and you're falling over. You're either going to put your foot down or you're going to start to hop so that you don't fall over. The weight shifting, moving the arms and legs with torsional twisting, is that you're keeping the center of gravity. So this is the perfect instance is somebody who's trying to surf or skateboard. They've got their arms up, they're shifting their body, trying to keep that center of gravity over the base depending on what surfaces they're going over. And then widening the base is the most basic of them all. And think of a toddler learning how to walk. They've got a wide stance to them, right? Their legs aren't in front of them. They're really wide. They're like a drunken sailor trying to keep their balance, trying to defy gravity. And it's super cute. But this is the same thing that we do if we're in an unstable situation. And we're going to talk a little bit more about what that parachute reflex is. Basically, if you're falling, you're going to put your arms out. At least you should be. So a little bit more on this weight shifting aspect. So If you have a surface, you can see here, there's a child on like a rocker board. And when you tilt the rocker board, they're going to extend their arm and their leg, and they are going to bend their body to that side to try and keep the balance. And this happens automatically. This is one of the reflexes that is intact. Depending, again, here we have prone, sitting, and standing. So depending on what position, that reflex will kick in when the surface is tilted. This one is showing this protective equilibrium reflex. Now, the bottom picture shows the upper extremity propping reactions. That's going to happen first, and this makes sense because babies are going to be sitting down first versus standing when the lower extremity or leg propping reactions would occur, like I said, with that leg going out to catch you from falling. So if you push a baby sideways, which is really funny when I'm doing it in the office and I'm like pushing them over and they're looking at me like, why are you pushing me? But if you push them over, then they should put their arm out to catch themselves. If you push them backwards, they should put their both arms out to catch themselves, and same thing to the front. So this is a propping reaction. And if somebody comes up and pushes you, you're going to push your arms back if they push you hard enough that you can't hold yourself up with your core. Now, the parachute reflex is one that appears at 6 months, remains for life, and it's protective. It catches the fall. So you can see the diagram there in the white. The top picture is showing when this does not occur. And so what I see with babies is I will kind of hold them and I actually kind of fly them to their mom. And if this reflex is working, they're going to put their arms out as a reflex. If it's not, they're going to try to grab onto me. They're going to put their arms back. They're not going to put them forward. And these are the kids that I hear, they're tripping and falling. And when they fall on their head because they don't put their arms out. So, and then you can see that little guy there showing an actual child doing that parachute reflex. So what happens if we are not having these reflexes develop in the appropriate time, in the appropriate manner? Well, you might have a delay in milestones because these are all tied into the brain development. So if they're not sitting up, if they're not crawling, if they're not walking, we're going to definitely want to check primitive reflexes because those might be retained. But if those are present, then I'm going to want to see if these equilibrium reflexes are there. And if they're not, then we can start doing some things. So like I said, they might be clumsy. They might trip and fall a lot, not use their arms to break their fall. They're going to have poor posture and poor body alignment, especially the older children. They're going to have poor balance and coordination. So this is where that clumsiness comes in. You know, I hear parents say, oh, my kid is such a klutz, and not realizing that it might be due to this underdeveloped equilibrium reflex or one of the other postural reflexes. Typically, these kids don't like sports because they're not good at it. It's hard. It's hard for them to balance. It's hard for them to coordinate. So they usually don't go for any sports. They'll have trouble with riding a bike. So they might be the older kid with like a tricycle or training wheels versus a two-wheeler. And they don't like to do games like jump rope and hopscotch and all those type of things. And believe it or not, this can also create issues with poor attention at school because the body, that proprioceptive response of the brain knowing where the body is disrupted. And so the focus that is needed to actually pay attention at school is taken away because the brain is trying to figure out what is going on. They also might have trouble copying notes from the blackboard or trouble reading from tracking words. And they also might have trouble building social relationships with their peers because if they don't know what is going on in their body, they can't relate to other people. And I talk a little bit more about this in the functional disconnection syndrome video I did. So I'll put a link to that. That has more to do with what's going on in the right and the left brain. So what why might this occur? Why might these equilibrium reflexes be underdeveloped? Well, as I said, there might still be retained primitive reflexes. Those are more at the foundation of the nervous system development. So if we don't have those integrated, then it's going to be very hard for the body to continue and the brain to continue with its development. So I've got to go back and look for those. A lot of what I see, especially nowadays, because there's more and more and more contraptions. I mean, there were a few when my kids were babies, but there's so many more now. So I've got a few pictures below. We've got the bouncy seats with the things hanging over, and look at that super saucer there with all that stuff on it. My gosh. And then the jumper there. That baby doesn't even, you can't even see their face. They're like hiding in the jumper. So think about this. What is involved in our brain development early on is that babies have to move their body, and the way they move it is those primitive reflexes at first. So if those aren't allowed to express themselves and then become integrated, then things are just going to spiral in a negative way. So I'm not a fan of any contraptions. If you've got to do something for a small period of time because you've got to do something like, go to the bathroom or take something off the stove, an enclosure like a play yard is the best because they can still lay down in that, or if they want to push them up to sitting or standing, they can, but they're using their body in an appropriate way. Sitting a baby up puts a lot of stress on their spine, and it affects their vestibular system, and they're in a contraption that they can only move in a limited way, which then is not giving them enough of a sensory, vestibular, and proprioceptive stimulation. Now, even some of these contraptions, because of putting that stress on the spine, can create subluxations, which are misalignments occurring in the spine, any part, the neck, the sacrum. So if you put a baby sitting that's not really sitting by themselves, that can be a lot of stress on their sacrum. That's the lower part of the spine. If they have not yet developed their curves in their neck and their low back, and you put them in a sitting position, that's going to put a lot of stress on their spine. So car seats are necessary evils. Use them in the car. Keep them in the car. Don't let your baby sleep in them. They should be as flat as possible, as much as possible, on their tummy, on their back. And the best thing is putting like a play gym over them so that they can look at things, roll over, and have these reflexes be stimulated so they can develop in a timely manner. Also, cranial restrictions can affect because of, even though this is a brain reflex, the lower reflexes are in the brainstem, which has to do with the cranial sacral system. And I'll put a video in here talking about cranial sacral for babies, which talks all about this, so you can look at that if you're interested. Then, if there has been chronic ear infections, this might have affected the vestibular cochlear nerve or the vestibular system. And certainly, if a child is having issues with their equilibrium, you also want to have their hearing checked, because that vestibular cochlear nerve, that cranial nerve 8, can be affected, and you just want to make sure there's no hearing issues. Okay, so what do I do if I'm suspecting there's underdeveloped equilibrium reflexes going on? Well, as I said, I'm going to take a history of the milestone development. There's usually delays in that. I'm going to evaluate their primitive reflexes. More likely than not, there are some that have not integrated. Of course, I'm going to check and see how good is their balance and coordination. I'm going to look at their posture, their core strength, look at all their systems involved here, the vestibular, the visual, the proprioception. I'm going to do my chiropractic and cranial sacral evaluation and see where there's restrictions and subluxations. And if you're in the Los Angeles area, of course, you can contact me, but if you're not, you can look for someone who is trained in functional neurology. There are diplomates in functional neurology, so they have different letters after their name. I am certified in childhood developmental disorders. That's the FAB-CDD. And my pediatric certification for chiropractic is the DICCP. So there's just some letters there. And if you need help finding somebody, you just contact me and let me know, and I can see if there's somebody in your area that might do this, or I might be able to help you remotely. All right, equilibrium reflex exercises in a younger child. Well, basically, you want to stimulate their senses: visual, proprioceptive, sensory, and certainly vestibular. You want to get them moving in all planes. So in the center there is one of those mats with like a play thing over, which is really great because this is going to be stimulating them to look and move, and those reflexes are going to be stimulated so that they can learn how to roll over from back to front and front to back, and then start to push up and get on their hands and knees. So that's a really great tool. Invest in those types of things, the mats and the little gyms that you put over. Getting something like an exercise ball is really great. So you can see that little guy there working on his tummy time on the ball, and that's reflex going on there too, a primitive reflex. Really great. You can get Bosu balls, which are like exercise balls but cut in half, and they have a flat side too, which you can sit your babies on and tilt it just like that little platform I showed you, with them laying down on their back or their front or on their hands and knees or sitting, whatever they can do at that time. And then get them moving in all directions, swinging and rotating and inverting, throwing them around safely. But all that motion, all that tumbling, all that kind of stuff really does give them the proper stimulation to get their posture and their balance and their equilibrium strong. Now for older children, you can still use things like the Bosu ball, exercise ball, balance boards, those dynamic discs that are kind of blown up flat discs that you can put on the floor. And then as they get better at balancing, you can do other activities. So if they're sitting on a ball, you can have them throw a ball back and forth to you, or you can play games. And those exercise balls make great chairs to do homework because it's dynamic. They're not sitting still. They have to use their core to balance and use their equilibrium reflexes to balance. So I really highly recommend getting an appropriate sized exercise ball for them to sit at home to do their homework. Other great things once they get better with their balance would be like hippity hops. Those are exercise balls with a little handle on it that they can hold on and hop on it. Pogo sticks, stilts, bicycles, skateboards, all those type of things, boogie boards, just whatever. You can never go wrong investing in those things. And again, you want them to swing, rotate, and invert in all directions. So things that do that, whether it's a tumbling class or gymnastics or just playing on a playground. I mean, there's nothing wrong with that. Little games that you can play for kids that really might need some help with balance is walking the plank. So that might be a line of chalk, or you can just walk on a curb, get a plank of wood, just take a garden hose and lay it out, even masking tape, just whatever you can do to make a line. And it can be curvy too. It doesn't have to be straight, but you can have them walk forwards and then they can go backwards once they get better at the forwards. Balancing on one foot. So this can be difficult for children. So you can, rather than having them hold on to something, they can be on a little step and then their other leg can hang off straight and they can start practicing that way. And then they can graduate to hopping on one foot or playing hopscotch or standing on uneven surfaces. And then once they master that with their eyes open, then you do it with eyes closed. And parents, I really highly recommend doing this with your children because it can get hard if you haven't been training your equilibrium system. So you can have challenges with your kids and motivate them, because when they see you're also working on it, it gives them more motivation themselves. And then just to have a little fun playing follow the leader. So, you can do things like gallop, skip, hop, jump, crawl, uh, make it more challenging as they get better at it. And obstacle courses are really great where you can be really creative and use pillows and those discs and those small basu balls that they can step on and boxes and whatever. Just use what you've got to create an obstacle course that you can walk around, run around, jump around, hop. Same thing as follow the leader. You can make a variety of movements. So here's just a few examples. Getting your kids doing things that are going to help challenge. Riding a bike takes a lot of skills, so you want to try and do that as soon as possible. And then we've got even more challenge with the inline skates, but you can see the basu ball there with the far right down at the bottom. And there's a disc, it's a fat disc right at the top left there. And there's an obstacle course in there. And those merry-go-rounds are really great for stimulating equilibrium. You might get a little dizzy, right? I know it. I've been training my vestibular system, and sometimes I do better than others. All right. Thank you so much for joining me. I can be found at Los Angeles Chiropractor, and you can see I've got all my certifications. But I think the biggest teacher of all is being the mother of 3 children. They're adults now, so they don't need my mothering anymore. But I'm still mom. They still ask my advice. And then the services that I can do range from obviously in office for the things that I need to do hands-on, but there's many things that I can do remotely. So feel free to reach out to me if you have questions. So I hope that you enjoyed this. If you did, if you found it useful, please like, subscribe, and please share with people, because this is really important for our children's development. That first year of life is super important to set them up for success for really the rest of their life. Thank you so much, and I will see you next week, same time, Tuesday night, 7 p.m. Pacific time. And if you can't catch me live, you can always catch the replay.